Right. Comment section, Tom. Let's look at some of these comments that you've highlighted.
Yeah, and I'll preface this by saying, these are the opinions of the people that wrote the comments, and
this is valid because it's people's experience. That is valid.
yes. So the first one I'll just read. My mother had 3 COVID vaccines, all Pfizer vaccines. She was healthy and had a stroke and coded in the hospital and died within 5 days. The funeral director is a good friend of the family's and informed us and showed us the white fibrous clots that were throughout her body.
Yeah.
He told us they were seeing a lot of these types of clots while embalming.
Yep.
Here's another one. My mom never had clotting issues before this incident. Then only 2 weeks after receiving the COVID shot, she was taken to the ER for multiple clots that developed in the same arm she received the COVID shot. So, I've got...
Yeah. So again, this first case here, again, the diagnosis made by the embalmer. I mean, diagnoses are supposed to be made by doctors and pathologists.
Yeah, but as we talked about last time, Dr. Campbell, I don't think that they're doing a good job of looking through the vascular system, right? If there is an autopsy done, and most of the time there is not, but even if there is one done, they're looking at the major organs, they'll look at the heart, but they usually don't go in and look closely at the veins and arteries. Yeah,
they take out blocks. And John O'Looney said this to me. He had a patient who, tragic, terrible young man, and the blocks of organs have been taken out as they do. But then when he started looking into the vessels in the legs, he pulled out a meter-long clot. It's
I know.
I mean, pathologists really need to get their act together here. They're clever people.
Exactly.
How can they be making such simple mistakes as not looking in the legs? It really is. I find it really quite difficult to explain, especially when there should be a high index of suspicion at the moment, because these facts have been
absolutely. And the whistleblower I talked to, John, said that the clots that he's been removing, they're not getting sent to pathology, so the evidence is being destroyed.
I mean, in clinical practice, Tom, you send everything to pathology. I was a theatre staff nurse for a while, and you spend maybe half a dozen times a day. The surgeon will say, "Oh, send a bit of that off." So you'll cut a bit off and you'll put it in the bottle and you'll preserve it and you'll write out and you'll send it to pathology. Then the pathologist puts it under the microscope because the surgeon's worried, because he needs the pathologist to diagnose it, because you can't, even if he suspects something's a malignancy, he still needs to send it to pathologist to get checked, or it might come there's not a malignancy, or you send anything that's any doubt at all, you just send it to pathology. It's just ingrained into medical practice, and yet
it's shocking, isn't it? It really is shocking.
It's really, really hard to explain.
Yeah. This one, surgical nurse, seeing a huge increase in clots. We are doing more amputations than I've ever seen in my whole career. I'm definitely seeing the clots you were describing. When I say it's probably due to the COVID shot, everyone ignores me and there is silence in the operating room. I also hear the surgeons saying, "I've never seen this before." Also, during heart surgeries, the surgeons are having a difficult time suturing as the tissues are just falling apart. Once again, the surgeons are saying, "I've never seen anything like this before." A lot of patients are dying.
Yeah, and we know that the death rates have been high for some time.
Yeah.
And of course, in my country, we've recently changed the way that excess deaths are calculated, so they've gone down a bit. That some people might think is a cynical ploy, but that's a separate topic.
Wow.
Yeah.
Here's the next one.
Yeah.
I was feeling fine, had pain left side below shoulder blade, started sweating and feeling weak. Called the ambulance. ECG did not show heart attack. Rushed to emergency. ECG did not show heart attack. Third different emergency. Doctor did ECG and an ultrasound. Yep. They were all perplexed. A cardiologist was called. I went to a heart institute. Arriving there, I went into cardiac arrest. Was out 2 minutes. 3 sets of compressions and 4 defibrillator shocks were used. They went in through an artery at the wrist. They removed a fibrous clot. They did not want to tell me, but a nurse whispered to me, "It's the vaccine. We have so many." Follow-up appointment with cardiologist. I asked the question directly. The doctor looked down and said, "I cannot talk about it at the risk of losing my job."
And of course, going in through the wrist for blockages in the coronary arteries is absolutely standard practice. That's what we do. Going through the radial artery, and you can get back into the aorta and then into the coronary arteries. But again, that last bit particularly alarming, Tom. I can't talk about it. It really is like regimes would rather not remember from the past, isn't it?
It's shocking to me. I expected a greater amount of integrity out of our medical system. I understand that big pharma is driven by money and may not have as much of a soul and a heart, but I thought that our doctors, I thought that our medical system, obeyed that Hippocratic oath of first do no harm. And it's saddening to me to think that these men and women out there that we respected so much and had so much trust in have now lost the trust of a lot of us, because we think that something is definitely going on, and it's quite obvious to a lot of us that there's a giant cover-up going on.
And even if there wasn't, the fact that a patient thinks this is appalling. The fact that this is the patient's experience is it's just the antithesis of transparent healthcare, isn't it?
Yes, it is, unfortunately.
Let's do a couple more of these, Tom, if you don't mind.
Yeah. I've got two more. My daughter died suddenly at age 45 in September of 2022. She was an athlete, and her heart stopped while working out. She was an emergency room registered nurse and mandated to take the bioweapon and all boosters. While on life support, they found a blockage just outside of her left ventricle. She suffered severe brain anoxia and was removed from life support. My son-in-law thought my insistence that this was from the bioweapon was complete lunacy. An autopsy was not offered, and she was cremated the next day. Oof. My family has no history of heart issues. My daughter was an active, 100% healthy, clean-eating mother of 5. She was murdered.
Well, we can't say whether she was murdered or not, but the fact that this individual thinks that is distressing.
Yes, it is. Yes, it is.
And again, cremation the next day. Why not do some pathology first? That really is.
Yeah.
Yeah. There's an old-fashioned saying, Tom, that doctors bury their mistakes. But if you've cremated it, that's even more final, isn't it?
Yes, it is. And as you can see there in that case, it appeared that the husband of the woman who passed, the son-in-law, or the son, was somewhat in denial himself, and maybe just were, So.
Well, it's because it's just about impossible to believe, isn't it? How could this possibly be?
It is, until you've done the research like we've had, and you've dug into it. I've dug into it. The embalmers like Richard Hirschman and John O'Looney have dug into this. We know what's happening.
We know. We just need. In a sense, we suspect what's happened, but we need to know what's happened through really hard data of thousands of people in different countries, and the research simply isn't being done, which is why it's so great that people like you are taking this on as a.
Well, it's sad. It's sad that a retired Air Force major has to do the job of the FDA, CDC, the NHS, the MHRA in your country. It's why.
Slightly more than sad, Tom, but yes, I agree. It is sad, yes.
Those three-letter organizations, they should be looking, right? They should be doing the surveys. And
absolutely.
And the Vascular Society should be doing the survey. And the British Institute of Embalmers should be doing the surveys.
Absolutely.
They should be doing this. It shouldn't have to depend on a retired Air Force major to do it.
No. Or an eccentric making videos in the north of England either. It's
The fact that they're not doing that should tell you something, right? The fact that they're not going forward and doing and surveying their own members of these organizations I think, tells you all you need to know.
Well, I'm sure viewers will tell us what they suspect is the reason for that, but we're certainly uncomfortable with it.
Yeah.
This is the last one, Tom.
Last one. I work fitting patients for compression garments. Most clots are in the legs, but several have expressed that the clots extended into their groins, stomach, chest, and one that went into the person's neck from their foot.
Wow.
Most have had clots removed and are now wearing very tight compression to prevent new clots.
Yeah.
I have fit men for medical pantyhose. This was rare before. My business has increased 3 times to what it was in 2023, and the number of young people are shocking. Very few people have told me that their issues are old or long-standing. Most have never had problems before.
Yeah.
Only one revealed their jab status, and they were jabbed/boosted. Many say the clots came on suddenly.
Yeah.
There's a definite pattern.
Yeah. And of course, compression hosiery is standard treatment for poor circulation and swelling in the lower limbs.
Yeah, but the fact that he's fitting younger people,
Yeah.
that's disturbing, right? And
Well,
that,
if you've got a blockage in the veins, then you're going to get swelling in the limb below that blockage or partial blockage. It generates a condition called chronic venous hypertension, where because there's a partial blockage of the veins working inefficiently, the blood behind dams back to a higher pressure, and the fluid comes out of the capillaries, and you get the swelling, which would necessitate these compression garments.
Prior to 2019, John,
Makes sense.
what age typically do people prior to 2019 start having trouble like that with blood flow in their legs?
Well,
and extremities?
occasionally you get a few young people who've got damage to the lymphatics, but typically they're pretty rare, and it's lymphatic edema. But typically the people that get these chronic venous hypertension problems have had deep venous thrombosis, have had blood clots in the past, or they've developed varicose veins, which can be genetic, but again, it's more in older people. So if people have had deep venous thrombosis, they can get it at any age, but of course that condition is normally in the older age group. So most of the people that get compression hosiery are in the older age groups, nearly all in 60s, 70s, 80s kind of age group. So a few younger people, but skewed very, very heavily into the older age groups, which is not what's being reported now.
Correct. Wow, it's just...
As you say, some of these are really quite distressing, but let's go through some.
Okay. First one here. June, my wife of 43 years, submitted herself to the COVID vaccine following the advice of government/medics and my insistence. June was an award-winning career state registered nurse, registered general nurse, and died aged 66 years. This occurred very suddenly in front of me while June was on the phone to a friend. June collapsed at the kitchen table. I administered CPR. I'm a retired police officer. June began to breathe again, but stopped again. Paramedics arrived, administered adrenaline and a defibrillator, but June was pronounced deceased around 6:45 p.m. on Wednesday, 8 December 2021. The event occurred 14 days after her latest COVID shot, which was the Moderna vaccine. A postmortem was conducted, and thrombosis, myocardial infarction, and heart failure listed as cause of death. No mention of the COVID vaccine.
Terrible.
Yeah,
Terrible.
One of the things, in the very first sentence there, you notice he said he wanted her to get the jab at his insistence as well. So I'm wondering if that gentleman feels guilt about, recommending the jab for his...
This is part of the appalling thing. We thought we were doing the right thing.
Yeah,
and now not only have we got this tragic death, I mean, again, we don't know if there's a causal relationship here, but even if there's not a causal relationship, this husband's left with this appalling doubt.
Yeah. One of the other things on here, Dr. Campbell, is you notice they said the event occurred 14 days after her latest shot. Now, that reminds me that, adverse events that happen less than 14 days after a jab, a lot of times were not counted as a vax injury because you're not considered fully vaccinated until after the 14-day period. So, and then, of course, the very last sentence, it talks about thrombosis there, but it doesn't say what type of clot. It doesn't say whether it was grape jelly or a white fibrous. So I think a lot of these death certificates don't have a lot of specific information on them, which I think they should, in terms of the type of clot. So,
Yeah, I mean, from what we have here, from the comment from this husband, it's a bit vague.
And that's I've been in contact with folks that have actually been looking at death records, death certificates, and trying to correlate those to vaccine injuries. And this is a very common thing. The death certificate will very vaguely state the person died from, myocardial infarction or thrombosis, but that's as specific as it gets. It doesn't talk in details about the type of clot and how long or large the clot was, that kind of thing.
Well, our condolences to June and her husband. It's
Yeah,
very,
very
very,
sad.
very sad.
The next two deal with eye problems, Dr. Campbell.
Okay.
This one, I began, and I've seen a lot of these, by the way, when I was tabulating up the Excel spreadsheets from ICANN. I came across quite a few people with eye problems. I began seeing what looked like chevrons in my left eye beginning about a week after my booster or third shot. While driving, I suddenly began to lose vision in my left eye. I pulled into a parking lot and lost complete vision in my left eye. It gradually returned fully after 10 minutes or less. My cardiologist put me on Xarelto and an 81 milligram baby aspirin daily. His idea was that my retinal artery became occluded by what he called microemboli. I think what we refer to as microclotting, right? That's the micro.
Oh, exactly what it is. I mean, a thrombosis is a clot where it developed, and an emboli just means a bit's broken off and travelled somewhere.
Right.
So yes, an emboli is a consequence of clotting. Of course.
Another thing to this entry makes me think of Dr. Campbell is he was sitting behind the wheel of a car. Luckily, he was able to pull off to the side. But what happens if somebody dies suddenly with a heart attack or stroke, and then they could be causing automobile accidents, right?
Oh, this has always happened, Tom, in clinical practice, that people have a car accident after an acute medical event.
Yeah.
Yeah.
I just think there's a higher chance of people having acute medical events these days.
Well, there's a lot of coincidences these days. Yeah.
Yeah, too many. The next one, also an eye one. Person was 68 and totally healthy. The reactions in the eye were not seen before. It hurts inside the eye. There was a bloodstream block inside the eye nerve. Any linkage to side effect were denied and was made impossible to talk about. The function of the eye was back to 60% and won't be better again. In Holland, nobody dares speak about this problem. This person got the advice to keep on having his next vaccination for COVID. He was himself in denial, but is not going to have his next jab.
Yeah.
All people in Holland have a letter with the advice to go for a jab again.
Yeah.
This one, to me, just brings out the whole thing about the silence. The government doesn't want you to talk about it. The medical community doesn't want to. The person who's had the problem doesn't want to talk about it. Yeah. And then also you still have the government and Big Pharma. You can see here in Holland, they're pushing the jabs, right? And that in my own country of the United States, there's this relentless push right now in the jabs. I can't turn on the radio or my TV without seeing a commercial for it. I watch a lot of football, college and pro football here on Saturdays and Sundays in the States. And there's so many commercials on with people like Travis Kelce, the tight end for the Kansas City Chiefs, saying, go get your shots. There's a professional singer named John Legend who's sitting at a piano, and he's showing you Band-Aids on his arm saying, go get your COVID vaccines. And I wonder whether these people have actually done the research themselves before they start promoting these things in terms of the adverse effects and what they might be pushing on people.
Well, we can't possibly say, but I'd be somewhat surprised if they were highly informed.
Yeah, me neither. Here's the next one. My aunt had a stroke and was dead within a week. I also had another aunt and good friend. Both got multiple shots, aunt in nursing home. Now they have AFib. Coworker died within a year of getting the shots with glioblastoma.
Glioblastoma, yeah. So atrial fibrillation is the original contraction of the heart.
Yes.
So it's irregular pulse caused by fibrillation of the upper chambers of the heart. Big risk with atrial fibrillation, of course, is stroke, blood clotting in the vessels. And glioblastoma is a tumour of the glial cells, the supportive tissue in the central nervous system.
Thank you. I didn't know that.
Yeah.
I have had other friends die suddenly. I work as a medical coder for an ER department, and I've seen a huge difference in young people with chest pains, heart issues, lots of people with DVTs, deep vein thrombosis.
Yeah.
Many more young people with cancers, so many more things than before. I didn't take the shot, was required with my job, but I got an exception. I no longer have faith in doctors/hospitals. Thank you for all the work you are doing. So I think she's thanking us, Dr. Campbell. This is another example of someone who's actually part of the medical system, right? Who themselves have lost faith in it.
Well, they're encoding the data. So again, it just lets you know that the data is there and it's available. Why isn't this data made available to, in an immediate, accessible form to the world's researchers? And indeed independent researchers.
One of the other things she said there is she's seeing more young people with cancers, and that's confirmed by the embalmers. Richard Hirschman tells me, and I think John O'Looney as well, they see a lot of young people on their tables who have died of cancer, and they actually still have all their hair. So it's quite obvious they haven't even been to their first chemotherapy treatment yet. They've been diagnosed with cancer, and it's gone stage 4 on them within a month or two, to the point where they even had time to take their first chemotherapy treatment.
Yeah, and this person does the medical encoding to code that data, so they will be seeing a large sample of this mortality data.
Yeah. Ready for the next one?
Yeah.
After a shot, I had horrible migraines, brain fog, and a TIA. That's a mini stroke, isn't it, Dr.
That's
Campbell?
a transient ischemic attack where the blood supply to the brain is reduced. You have cerebrovascular stroke type features, and then it resolves within 2 or 3 days. I think, can't remember the time frame now, but it resolves anyway.
My D dimer was over 1800 at that point. Previously, it was in the normal range. I started taking aspirin immediately after TIA symptoms. Began fasting, cold plunges, nattokinase. Several D dimer labs showed my values slowly dropping as time went on. It took 3 years for my D dimer to return to normal. I had only the first shot, part 1 of 2-part shot, Pfizer batch number ER8721, which was associated with extremely high adverse reactions. I suffered many other horrible symptoms and nearly died. By the grace of God and my prayers, I am still here. My health is much improved, but my memory isn't what it used to be, and my autoimmune diseases became more pronounced. Yeah. I'm so grateful I was not more seriously harmed. I will never again go against my instincts to let myself be bullied into something I have serious reservations about.
Of course, we've just looked at research from Vibeke Manniker in Denmark and Sweden, who found great variability in the suspected adverse reactions reported between different batches.
Right. I've seen the blue batches that were the worst, and the green batches moderate, and then the yellow batches were almost placebo-like. Yeah.
Some batches hardly any, and other batches, the worst batch I think was 1 person in 20 having a suspected adverse reaction.
Right. One of the things I noticed there is, she lists actually the batch number. I think there's a website you can go to called How Bad Is My Batch to find out how hot your batch was if you received a COVID-19 vaccine.
Yeah, also, of course, there should be no difference at all because there should have been manufacturing consistency.
Yeah, what you just said about Viveka, and the 3 separate lines with different batches, that's not a good sign, is it? That means that
no, that simply shouldn't be there.
Yeah, there was sloppiness in the manufacturing process, right?
Yeah, well, we would expect the same number of suspected adverse reactions to be reported independent of batch, but that was not the case.
Yeah, absolutely. Another thing that caught my eye here is that she said it took 3 years for her D dimer level to return to normal.
Yeah.
And I think that's common for a lot of these people who have been vaccine injury. It's a slow process to recovery, not a quick recovery.
Indeed.
And then, of course, her last sentence there, that I think is the most important takeaway. Take charge of your own health, right? Don't get bullied into doing something you don't want to do.
Yeah. Informed consent.
Correct. Ready for the next one? 2 bad batches of Moderna in the summer of 2021. Allergic reaction after the first shot. Overall decline in health began soon afterwards. Went from a normal 20-something female to disabled, no longer able to work, using walker or wheelchair. No diagnosis until tested by Dr. Jordan Vaughn in early 2024. Stage 4 of 4 significant and widespread amyloid fibrin microclotting, iliac vein compression syndrome, POTS, numerous other muscular and neuro symptoms, spike protein count of almost 13,000, been under treatment with various drugs, supplements, blood thinners since early 2024, but still disabled. So sad
Terrible.
case.
I mean, this is a young woman, 20-something.
Yeah, 20 years old. So it's, and it's Dr. Jordan Vaughn, by the way, here is a hero. He's appeared with Dr. Pierre Corey on
Right.
Cheryl Atkinson's Full Measure TV show. He runs a practice in Birmingham, Alabama, and he and Dr. Corey are on the right on the tip of the spear in terms of treating vaccine-injured people for both the white fibrous clots and microclotting as well, particularly the microclotting issue. So there are doctors out there all over the world that are awake and are able to treat vaccine-injured people. Here in the USA, we have an organization called the FLCCC.
Yeah.
Yeah, the Frontline COVID Critical Care Alliance.
Yeah.
And they can actually help people find providers in their area to go to that understand vaccine injuries. So people can go there. Next one. Here's another example, Dr. Campbell, of someone who's actually in the medical system who's also seeing the horror.
Yeah.
I'm a registered nurse working in interventional radiology.
Yeah.
January 7, 2022, we had an emergency procedure to remove the right leg blood clot from a Japanese male in his late 70s. On assessment, no pedal pulses.
Pedal, that means in the foot.
Okay.
It means the pulse is in the foot.
It's in the foot? Okay, I wasn't sure. Or any
it's
other
the dorsalis pedis pulse. It's the pulse on the top of the foot.
So they could not detect a pulse on the foot. That's how poor the circulation was?
Yeah, the blood wasn't getting down into his foot, yeah.
On assessment, no pedal pulses or any other pulses, including femoral pulse, using
Femoral,
ultrasound.
yeah.
His leg was about 4 times the size of his left leg.
Wow.
Wow. We called in the vascular rep who had a new corkscrew-like drill to assist with removal. It went up through his abdomen and was like nothing any of us had seen. I took pictures per my radiologist's request. I'm not sure if he survived or further outcome. He went back to ER to wait for an ICU bed. Also, nurse friend ended up with a occluded right carotid artery approximately a year and a half after receiving the Johnson & Johnson. Has been on Eliquis, but recently had her left great toe amputated. We'll try to send a picture to your email of the clots removed. So, first of all, I was taken aback by it. It sounds like there's a new tool out, maybe because they have to deal with some new, harder to get out clots. I mentioned on your show last time.
These clever vascular people are always working on new techniques. That's not surprising. It's
well, I was aware. I know they had 3 types of catheter, flexible catheters they put into people.
Yeah.
They can either suck out the clot, scrape it out, or they can lasso it and pull it out. These white fibrous clots. But it sounds like this new corkscrew one is a new one. So the other thing that shocked me here is that last sentence. Yeah. I will try to send you a picture to your email of the clots removed. Why does she need to try to sneak a picture to me? Yeah. Why don't the doctors there,
Yeah, these should be published.
Absolutely.
Yeah.
Shocking. Got one more for you.
Yep.
I suffered a left thalamic.
So the thalamic nuclei, there's one in each side of the brain.
Okay. I was unfamiliar with that term. I know what an ischemic stroke is, though, right? That's when the blood clots in the vein or artery.
No, ischemic means that would be thromboembolic. Ischemic means inadequate blood supply.
Right.
So there was a stroke, so there was damage, a cerebrovascular accident to the area of the thalamus as a result of reduced blood supply.
As opposed to like a hemorrhagic stroke, right, where the blood vessel actually burst. Yeah.
Correct. Yes,
okay, so
yes.
Ischemic stroke shortly after receiving the Pfizer COVID-19 vaccine. The stroke occurred on April 30th, 2021, 18 days after the vaccine was administered on the 12th of April, 2021. The stroke resulted in significant medical complications, including physical impairments. At the time, my doctors did not initially suspect any connection to the vaccine. At least not during 2021 and 2022. I have since moved on to another specialist, and many say that they have been exposed to many people complaining of vaccine-related symptoms. I'm a 33-year-old Navy air traffic control veteran, and I work for the FAA. I'm married with 3 children, and unfortunately, this stroke led to the loss of my job. John, what do these people do now? Their lives are ruined.
Indeed. Indeed.
And remember, this is just a couple of 500 of these types of responses we got in just 24 hours after putting the QR code out for you.
Yeah.
I'm just shocked by all this.
And they're all in the public domain. People can read them on the comments of the video.
Yeah. So what are we going to do, John, about all this? How are we going to get these people's stories told?
People can still scan in that code, give us their experiences. Collecting more data is good. This needs to be written up in some sort of peer-reviewed publication if possible. And all we can hope to do really is give people information and allow them to then make informed decisions. Exactly. But there needs to be recognition of the amount of suffering here that's occurred and is occurring.
And you've done a terrific job, and you've had dozens of people on your channel. You've interviewed them in person, talking about all the problems they've had. I've seen the people that had, legs amputated below the knee, and
Alex came down to tell us about that experience. Appalling. Yeah.
So thank you for doing that. Because these people, I think, part of this whole exercise is cathartic to them in a way, right? Finally somebody recognizes that they're having these problems.
It's good that they know they're not suffering alone. I think that helps.
I do too.
If people think they're the only one, then okay, there's one unfortunate person in the country, but it's not that. And now they know that other people are suffering in the same way, and help groups are being formed.
We'll keep getting more data, and we'll report back to you.
Thank you, Tom. But for now, thank you very much, and thank you everyone for watching.
Thank you, Dr. Campbell.